All right. What about your outlook? So it's not thinking anything.
Check, can you guys online hear us?
Yes.
I can hear you.
Can you hear?
Hi. Did you hear me?
Yes.
Yes.
You just have to close out your outlook. Welcome to our final Board of the Health meeting, Board of the Health health meeting for the year. We have a relatively large agenda for the day, so I'm going to go ahead and get us started right away. We do have somebody for privilege of the floor, Manny Dong, if I'm saying your name correctly. Okay, thank you. So if you want to, why don't you come on up here and take a seat right here? So just for point of reference for board members, this is related to resolution with number 8 on your agenda for Benjamin Hill Heights. Okay, Manny, so you have about 3 minutes to address the board, okay? And then we'll ask questions if we have questions, and then you're welcome to stay after that, and then we'll actually talk about the enforcement action later in the agenda. Okay?
Yeah, I'm the owner of the Benjamin Hill Heights mobile home park. So we have water supplied by the town of Newfield. So I just we have a house and just have the meters there, and I have also a pressure pressure meters there, and just monitor the water usage. In the 2017, and I have some lower pressure, some tenants complaint, and I think I called the health department. I think they talked to town of Newfield, made some adjustment. The pressure is okay. And then this year in April, and the town of Newfield do the flushing. After flushing, the temperature is low. So I, thought maybe a leak or some, just check all the leak, check all the pipe, and finally found it's not a leak, and just the pressure is low. So I talked to Newfield and also called the New York Rural Water Association, because I'm a member. They come here to check that it did all things and didn't find it because the pressure supply is low. Then I found my email that in 2017 they said pressure should be around 55, but now it's about 46, 48. So at that time, I think I talked to the department and talked to the New York State Rural Association. They said we want to find solutions that are Newfield. But anyway, and I think then I received a letter from the health department that said I'm responsible to install the pressure booster pump there, tank there to increase the pressure. So I agreed to do that. Then I called the engineering to design a map how to install the pressure pump booster tank. I called the different plumbers. It's not this year. Why it's very hard to find contractors and available. The shortage everywhere. So finally, I found a contract, and he called in a different place to order the pressure tank. And then finally, in November 10th, and one of the supply, the shop here agreed to order special. Here to be special order, so they put the special order 11/10. They told me yesterday, so it's need 35 business days and to get back. So, and he said they'll probably arrive at beginning of January, and the tag will be arrived. But I still agreed to install that. But my concern now is that in the January, the temperature is very low. And then if we stop, the water to install the tank, then the mobile home park, every trailer, they have this heat tip, everything there. I'm afraid that maybe the cost, freezing pipe at that time. So for me, and today, I think that I agree to install that, but I think it's maybe in March or April I install that. Even I received that, but I don't think if we stop the water don't flow that, then cause the freezing pipe there. Another thing that is the residents there, the water pressure is okay. The reason why it's slow because we have a hill. The hill goes up. Only the residents at the top said they are low because above, below that everybody is okay. Only have the one of the tenants there. And so now she told me pressure is okay. I think probably pressure increased. So I'm thinking I'm going to still install this pressure tank there. But I think at this kind of the weather, winter, because everything's happened. So I think I'm asking to see if I can install, after March when the weather gets warm, so we don't have a problem to do that. So this is just the situation I have. I'm trying to, I'm just the one that pays the water bill to the new field. I think it's even I bought park in 2016. I collected the water bill. It said to me, I just pay to the new field. So I'm the owner, but the water come to the park. I'm just
Okay, thank you. Thank you for that. So just so I'm clear for board members, you're asking to delay when you need to implement the water pressure regulator. Sorry if I'm not saying that technically correct, but okay. Are there any questions from board members right now? Okay, so thank you very much for coming to see us, and you're welcome to stay, and then we'll take this up when we talk about it later. Okay. Okay. Thank you. Okay, let's go ahead and move on to our October 25th minutes. If I could get a motion to approve as written. First from Shauna, a second from Sue. Any discussion or corrections on these? Are needed. Okay, all in favor? Opposed and abstentions? We've got one abstention. Okay, great. The financial summary, is there?
Brenda's on.
Oh, Brenda's online. Okay. Hi, Brenda.
Hi there. I've included a November 2022. It is a partial month because I pulled the report in time to get it submitted to you, but I thought it was a little more current than if it sent you October. This report is pulled from the county's books and not from our departmental books. And you'll note that the county has not posted two payrolls, which would have been an end of October into November and then a November payroll. So the salary figures are running low as well as the fringe at the moment. We are in the midst of filing all of our third quarter claims. There's always a big flurry of activity at the end of the fiscal year. So we are all quite busy. We have spending going on, people working on revenue projections and bringing in revenue, but I don't have anything further to add to my written report.
Thanks, Brenda. And so where's the health department going to end up generally by the end once everything's in? Are you under, over, about right?
I don't really know because there is such a big activity and there's a bit of payroll still to post.
Okay.
Excuse me,
Okay.
but I can tell you Karen filed the third quarter state aid and we have almost hit our target of excuse me, 1,568,000 which is not reflected here, but we have almost hit our target budget of state aid. So we will exceed our state aid revenue projection this year. That is largely due to the state aid reimbursement on fringes as of, I think it was April 1st. That was not originally planned.
Thanks, Brenda.
Generally speaking, we're expecting to come in under budget,
Yes.
not over budget.
Questions from board members? Frank, thanks, Brenda.
You're welcome.
Frank for administrative report.
Yeah, just one update wanted to provide where we have an all staff meeting scheduled for Thursday where we're bringing everyone together from both buildings. It will be our first all staff meeting as Tompkins County Whole Health. We'll be meeting down at the Green Street facility, so the folks here at Brown Road can get a chance to see that building. We've got a full agenda for the whole day for staff. But one of probably the most exciting parts is we'll be announcing our new logo at that meeting. So I wanted staff to be the first to see it, so you guys will get it shortly thereafter. What I can tell you is we did have a team of folks that worked with our consultants to both come up with the name and the logo. Using the consultant's expertise, they really steered us towards what they believe is industry standard, which is similar to what Cuyahoga Health Systems has done. You all have probably seen that two-color logo that they use for everything. So it's similar for us. There is a logo, a mark that is then associated with the name of the department, which once we get that out there and people become familiar with it, it's connected to our department, all the different programming will then be able to use that mark with the name of their program as well. So it'll create a lot of flexibility for us in moving forward. We do have a communications plan that's in the works. We're going to do a soft release in December, more of a kind of coming soon kind of approach. And then in January, we'll be doing our full launching of the new name and logo, and really using it as a way to introduce all of the many services that we provide to the community. So we're excited for that to be happening. Just wanted you guys to be aware, they'll be seeing that on Thursday. You will likely get a chance to see it either Friday or Monday. We'll send it out to you via email. That's all I have.
Thanks. Any questions for Frank? Okay, let's move on to Sam and Ted. And just a reminder to board members that we have under new business today, or I'm sorry, administration discussion. We're going to be talking about the community health assessment and improvement plan. So let's hold discussion on that till then. But Sam and Ted, anything in addition to your report?
I just wanted to update that we had mentioned that we applied for a NACHO Health Equity and Overdose Prevention Program, mentorship program, but unfortunately we did not receive that. I think there was actually a lot of interest, so hopefully NACHO will do something like that in the future. But I know that our colleagues, Harmony, Brenda, one of our public health fellows, are certainly working on other initiatives around opioid prevention. And then otherwise, just lots of different communications happening. We had an immunization coalition meeting this morning talking about the high flu rates. So we're planning to do some more strategic communication around that and utilize our community health workers to be promoting flu vaccine as well. Working on the whole health branding that Frank mentioned. We're continuing to work with the consultant who we hired for some other materials around that to roll out in the new year. And we will have some updates to our COVID data reporting by later in the month, hopefully before the holidays, just in response to some changes happening at the state. So stay posted for that, but our data will essentially be pulling directly from state and CDC data sources going forward. So that's all I have for now, but any questions?
Questions from board members? Can I just ask about the pulling from state and CDC? So I understand. So you won't be collecting and collating data independent of those sources okay, so are you going to change the reporting that's on the website then? Okay.
Yep. Yeah. So it's going to look a little different. I mean, we've been using, state data certainly through a Claire system that we use, but this will, we will be changing that table into more of a dashboard so that it's connected directly to these state databases.
Shifting to weekly updates from daily updates.
And are you doing a communication, Sam, out to the community about those changes? Okay.
Yes, definitely.
Okay.
Mhm.
Okay, great. Thanks. Any other questions? Sorry. Okay, Dr. Claypack for the medical director's report.
Well, first of all, hello and season's greetings to all of you. Good to see your faces. Kind of a chilly day, drizzly out there. I took special note in your last board meeting of how you addressed the issues about vaping and the infractions that you had to deal with in our community. Certainly a serious issue and worthy of taking seriously. In terms of the THC legalization and the rollout of retail sales and the actions of the Office of Cannabis Management, we're in a phase of promulgation of rules and regulations with regard to, I'll read it off an email I have, packaging, labeling, marketing, advertising, and laboratory permitting, oversight and testing of adult use cannabis, and now is progressing into a public comment phase. There's a 45-day comment period, which is anticipated to begin tomorrow, which will end on January 23rd. The regulations are stated to be designed to protect public health and reduce waste, and they include requirements for child-resistant packaging and labeling that identifies products as containing cannabis with THC, limiting marketing to adult-only audiences, and the rules for establishing testing procedures to ensure that products are safe for consumption. So this announcement of these actions was very coincident with a piece in the New York Times that came out in the last week. And that piece in the New York Times documented allegations of mislabeling and illegal marketing by THC on licensed storefronts in New York City. And the concerning thing, of course, was not only were they illegal, but they were also contaminated. And the contaminations were in the areas of infectious material, bacteria, in the area of heavy metals, and in the area of toxic pesticides. Obviously, this should be a strong concern from all of us in the community, and is the very thing that legalization of THC back in 20, whatever it was, back ways when the New York State DOH, in evaluating whether to legalize, said that unbalanced and unregulated market is a hazard to our young people and to our population. So I think the Office of Cannabis Management is progressing in a very logical direction. And I think public comment is where we step in and make our comments about whether what they're proposing looks good to us or whether it doesn't. So I encourage all members of the community and our board and myself to look closely at what they're proposing and to say yay or nay or offer our expertise. This obviously doesn't address the vaping issue that you dealt with before, because what you're dealing with is already prohibited by law. But there stands our obligation to enforce the law and enforce public health regulations for the health and safety of everybody in this community. Any questions? I'll be glad to take them. Thank you.
Thank you. And did you include the link to that in the public comment stuff in your comments? I don't.
No, the link to the New York Times article, is that what you're speaking about?
No, where you were recommending people look to make public comments?
No, I didn't. I can certainly provide you with information about that.
Karen, would you mind sending that around to us? Thank you so much. Sorry, Shauna, thank you.
Yeah, I guess I was wondering, as a Board of Health, is there any type of action that we could take to prohibit the sale of cannabis in some of these sticker stores that are popping up throughout Ithaca? I know that there are 4 or 5 different places in Ithaca. One that is very, very much so open about their sale of cannabis, THC. And you walk inside and kids are selling packages that look like Sour Patch Kids, Cheetos, Oreos, Fruit Loops, all of that. And I could very easily see one of our young individuals getting a hold of those thinking that they're a snack. And us, all really being concerned about that.
So I'll start and then turn to my attorney. I think it's possible. I think that it's challenging from an enforcement perspective right now because the state has essentially taken this legalization path, but is not yet up to speed, as we all know, on how they're going to implement all of this. I think we would be in a very difficult place in trying to enforce that because our main mechanisms are through fining, right? And we're going to be talking about that next month around vaping as well. And because of kind of the ambiguity at the state level, I think it would be difficult. I don't know, Bill, if you have any thought or take on.
I think the system is just coming into place and everyone's looking at opening stores rather than trying to close them. So unless there's some statutory language that allows us to do it, we probably can't do it.
I know that there was some conversation on the state level that people that are currently opening up stores right now, this could have a negative consequence on then obtaining a license in the future. And my issue is not with the selling. I don't have a problem with that at all. I don't even have a problem with them selling like leaf and joints, but I do have a problem with them marketing towards kids.
Let me just add one comment. Back a number of months ago, perhaps in the summer, we became aware of at least one retail outlet that was using a coupon sticker modality to not market, but actually be in that way marketing products that would be otherwise illegal. The state Office of Cannabis Management, if they become aware of these business locations, will issue, if they find it warranted, a cease and desist order. That cease and desist order, I believe, can be followed up by some action on their part. So members of the community who are aware of what they think may be actions by a retail outlet that are not legal, are not approved of, can certainly communicate with the Office of Cannabis Management and notify them of the details.
Thank you for all the comments. Other questions?
just to kind of follow up on that, if you want to send the department the facilities that you believe are out of compliance, we can certainly submit that information for you from the Office of Cannabis Management.
Okay.
Oh,
I'm gonna start, if you don't mind,
Sure.
on the Director of Community Health. So as everyone's aware, Claire has left us. Her last day was the 28th, I think, of November. But I'm happy to be able to announce that Rachel Buckwalter has accepted the position as our next Director of Community Health.
Yeah.
I think everyone knows Rachel. Yes, thank you. Rachel's been with the department for almost 10 years now. Started as a community health nurse, has been a senior community health nurse for the last couple of years, has really been leading our COVID disease response for the last year plus, and has done an amazing job. So we're excited to have her in that new role, and we're all looking to support her in being successful as she goes forward. So for that, I don't know if Rachel, if you had anything you wanted to add to the report.
Yeah. Congratulations. Okay. Thank you. Okay, any questions for Rachel on the report that she submitted? Okay. Congratulations, Rachel. Thank you for staying and continuing in such an important role, so. Okay, so next we have children with special health care needs.
Debbie's behind
Oh,
us.
behind.
Behind my report. About the children providers. Critical or wait lists in several disciplines in our county. There's some increase early intervention providers. So I did reach out to Shauna and did support for this. They asked me to write a resolution.
You preemptively. Thank you, Shauna, and to your colleagues for taking that on. So did we hear anything back on that, or it hasn't gone yet?
I believe we passed it at our last meeting,
Okay,
and I mean, typically we don't hear back.
I'll hear back.
Budget will come out in February.
Yeah.
And we'll see if it's included.
Okay.
Frank and Christina, I just wanted to let you know that we could not really hear Rachel or Debbie. So just if you want to recap, that would be.
Okay. So Rachel is the new, what's the right title? Director of Community Health. Congratulations to Rachel. She did not have anything additional to add to the report that was submitted, except that she will provide me with the copy of their minutes to sign, because that's a requirement for the Board of Health. And then the update from Children with Special Health Care Needs was related to the resolution that was provided in the board packet that people can familiarize themselves with, that the legislature asked them to draft up, which was then supported and sent on to Albany. Is that a fair summary? Okay, so let's go ahead and move on to the county attorney's report. If anything.
It's been quiet and nothing.
Okay, so quiet and nothing to report from the county attorney. Environmental health, Liz, I think they are able to hear you, so, okay.
I'd like to call attention that there's a hard copy of a letter from actually an email I Express.
Yep.
I think these also went out by email. In case you didn't get them because they were received okay. And there's also a letter from Applegate Mobile Home in front of you that we can discuss during those items, but I want to add them. And Michelle Palmer is here from Bethlehem Landscape Design Architecture. I don't know if you wanna, she's waving in the back. She's the lead for Witham for Pass Streets.
Okay.
She's really good.
Okay, and just, can I just go back to line things up for board members? So there's an email that came for resolution number 5 on your agenda from Taste of Thai. Then there's also one for resolution number 7. And then we have, we had the presentation on number 8. And then we also have a visitor on number 10.
And with regard to number 7, for Applegate Mobile Home Park, he is requesting a reduced penalty, and we would like to pull that item from the agenda if board approval, so that we have time to review the resolution, revise it with his request, and do a more structured penalty.
Okay.
I'm not sure when we do that, whether
Okay, let's come back to that. I'll do it right when we get into that section. And remind me when I forget in 30 seconds, because that's about how long my memory lasts. Okay. Okay, so anything else, Liz?
I have nothing else.
Okay, any questions for Liz on reports to the board?
Can we just do a mic check? Were you all able to hear Liz okay online?
Yes.
Thank you. She's gonna be talking a lot.
Okay.
It was choppy. It was kind of choppy. It went in and out.
Okay, so maybe we can move this, maybe
Yeah.
we should move Liz in, not yet, but when we get to the, when
We
we,
can just move the microphone.
yeah, move the mic. Okay. All right, so Harmony, the CSB report.
Yes, the report. It was last night, so it's easy to remember this time.
Oh, there's Harmony. Yeah.
Did you want to go, Harmony?
Sure. Sorry about that. I was having a hard time clicking. Yeah, it is easy to, and Frank would be really good at this because he did much of the presentation. He provided the same information to you on the staff meeting we're having on Thursday, the new logo and the rollout of that information to the staff and then to the public with a communication plan in the future. He also provided an overview of information that's been shared with the opioid task force. So it was a lot of information for people to digest with links to other resources that they could read about just data on substance use in general, information specific to our county, and also some resources on ways to help address that problem. And the meeting ended with a slate of officers being selected, and they will be voted on next year, and adding some people to some of our subcommittees. And
Okay,
then-
anything else? All right, any questions for Harmony? Anybody? Okay, so let's go ahead now and move to the enforcement actions. Does the board have to vote on Liz removing something from the
No,
agenda? We
as
can
long
just
as
permit her to do it. Does anyone have any concerns with removing that? Okay, so we're pulling number 7 off of the agenda and won't be having a discussion about that per staff request so that they can redo the enforcement action. So let's go ahead and start with resolution number 1 related to the Trumansburg Main Street Market. This is a hot holding issue, I think. So can I have a motion to approve as written? For there, we have a first from Ed, a second from Melissa. Any discussion on this? Liz, is there anything you'd like to talk about?
The proposed penalty is the standard $200.
Questions from board members, comments? Okay, all in favor as written. That's unanimous.
Could you put that?
Yeah.
Now it's harder to hear Liz.
Microphone over to.
Thank you.
She's special. Yes. You have to project, Liz, right? You have to use your. Okay, resolution number 2 related to Casper's Kitchen. we'll need a motion. Okay, we've got a motion to approve, a first from David, a second from Samara. Any comments from Liz or other questions?
There were multiple violations on this one, and so then the proposed penalty based on our risk structure is $400.
Do you have a question? Okay, you look like you were. All right, any other questions or comments? Okay, all in favor is written. Any opposition or abstentions? Nope. Okay, so unanimous. What's up?
Shauna is not present.
Yeah, and Shauna has left the meeting, but we're still at quorum.
Liz, can you move that chair up there just so folks can see you? Thank you.
Closer.
Yeah.
Lots of Liz related issues today.
What happens? Give us an agenda.
Okay, so for resolution number 3, SPM empanadas throughout Tompkins. Oh. Okay, is that their full name? Oh, I get it. Okay, I'm on board. Okay, motion as written. I gotta have a first from Melissa, a second from Ed. Sorry, Sue, I'll catch you next time. Any any discussion, Liz, on this, or questions or comments from board members?
Holding violations with the $200.
Yeah. Okay, anybody? All right, all in favor is written. And we're unanimous again. Okay, resolution number 4, Zocala Mexican Bar and Grill. We'll need a motion to approve as written. First from Sue. Second from Samara. Oh, I missed you now.
That's okay. That's okay.
Okay, any questions or discussion on this? Liz, is there anything?
This is violation of Board of Health orders. They had both cold holding and hot holding violations. And so the proposed penalty is $800.
Any questions from board members? All right, all in favor is written. No opposition or abstentions, so that's unanimous. Okay. So now we're on to resolution number 5, Taste of Thai Express. I'm going to put it under motion as written, and then we'll discuss the email and any changes that if any. Okay. So a motion to approve is written. Okay, first from Ed, second from David. All right, let's go ahead and discuss the email that we received and also the recommendations from the environmental health staff. So Liz, if you're able to summarize for us, that would be super helpful.
Yes, this is a violation of Board of Health orders. Taste of Thai Express has been brought to the board since almost annually since 2016, with the exception of when we were doing, they were closed or we were doing COVID inspections in 2020 and 2021. So the only new addition to this order from past orders is that we're requiring that they contract with a food safety expert and prepare a food safety plan, essentially. And we are in conversations with them on doing that. They submitted the email letter that you have in front of you. Most of the things are things that we would be addressing within environmental health, with environmental health staff. However, they have requested an extension to resolution number 2, and EH does support an extension to February 17th.
Okay. So the letter is written, though, requires that they do it by a certain date, correct?
The current resolution has a date of January 13th.
Okay.
And we support an extension to February, I lost that, 17th.
Okay, let's talk about that request.
And the proposed penalty is $1,600.
Okay, so let's talk about the request to move it to February 17th. Do we want to discuss that a little bit first, or any questions or concerns on that? Okay, you might have to help me.
You can just make it, if it's friendly to the mover and seconder, we can just make that amendment.
Okay, is that friendly for everybody? Okay. so we'll go ahead and make that. We'll agree with that. And then the other question I had on this was the question that they had in there about the payment plan, wanting to do it in 3 payments. Is that something that we need to reflect in the letter as well, or that's just something you can work it out? Okay. Okay, I just wasn't sure on that. Okay, so that addresses everything that they'd like. So now we're voting on, I'm sorry, are there any other issues to discuss related to this? First. Okay, so we're voting to approve with the friendly amendment of the change to the date of February 17th. Okay, so all in favor? Anyone opposed or abstaining? No, so that's unanimous. Okay, let's move on to number 6, which is Dollar General. So we'll need a motion to approve as written.
I'll do that.
All right, we have a first from David, a second from Melissa. Let's open for discussion. This one was about drinking water and septic.
Yes.
Okay.
It was primarily related to their drinking water treatment system. We have had several issues with them and with other Dollar Generals and throughout Tompkins County. This is for the North Lansing Dollar General. They've been on a boil water order since February. They had engineering plans for a water system. The system was not constructed fully in accordance with those plans. When we did a site visit, it was revealed that wasn't constructed according to fully to the plans, that the plans did not show this stormwater pond that had a sewage discharge to it. That is very close to their drinking water well. And so they need to submit revised plans to address these issues. The corporate structure is complex. It's taken us a while working with them to determine how to structure who it goes to. So this is going to GTB. I think that's it. As the owner of the property, and Dollar General operates the water system. There were multiple violations of the subpart 5-1 for water systems. And we have a proposed penalty of $3,500. They are a regulated public water system because they have a bathroom, a public bathroom, and a drinking fountain. It's essentially very low risk, public health risk. They are regulated, and the code officer has stated that it's a requirement that they have a public bathroom. So they do not have the option of not being a regulated public water system by removing public access. So.
Curious about that, so thank you. Yeah, I wasn't quite understanding the connection, so that was super helpful for me.
Yeah.
Okay, so any other questions or comments from board members on this? Yes, Sue.
Just for clarification, so they're in Lansing, but there's no public water supply.
They're on a well.
They're on a well, so it's their own water supply. But
Yes.
they're having to keep it, okay.
And they have
And then the January 1st, submit plans and an engineering report. Is that feasible? Start.
since February.
Oh,
So we
okay.
have been in, so it's just to submit plans, this is just December, right? So they have an engineer, they had one before. So it is certainly feasible to submit plans within a month.
The note on your letter that says, or permanently prohibit public access to restrooms. Is it possible in code to actually have a public bathroom, but then prohibit access or not?
That's not.
So that's,
But from the code officer, so yeah, 7B is not an option.
All right.
It's what we learned after
After,
the regulation, the resolution.
Okay, so will you be editing?
No, I mean, they just can't, they're not allowed to do it.
Oh,
So
okay.
they have to do the other option.
Got it. Okay, sorry. Questions? Ready to vote? All right, all in favor then is written? And no oppositions or abstentions, so that's unanimous. Okay, so as a reminder, number 7 is off the agenda. So we're moving to number 8, which is Benjamin Hill Heights, which is the sufficient water pressure issue. And Mr. Dong was kind enough to come to the board meeting to present. So let's go ahead and put this one under a motion to approve as written. First from Melissa, a second from David. And can we open for discussion now, please? So maybe from your perspective, Liz, can you help us understand what's going on here?
So these are public water system violations at the mobile home park due to inadequate pressure. They are not maintaining the required 20 PSI. We have proposed a $500 penalty for this. They need to put in a booster pump to increase the pressure so that they meet that throughout the park. We have received engineering plans for this, so all they need to do is implement it. We are agreeable to extend the deadline on number 2 from December 16th, 2022 to January 30th, 2023. Construction is done during the winter. We do not see a need to delay it till March, but we are willing, considering potential supply chain issues, to change the deadline to January 30th, 2023.
Questions or comments from board members on that? Or I asked for a friendly amendment. Yeah.
So if, because we all know the supply chain has been very variable, if they can't get the required part or whatever, are they able to come back and ask for another extension?
We can always do a revised resolution if needed.
Without penalty to them, right?
Yes.
Okay.
You guys are the ones who determine what penalties are assigned.
Concerns about pipes freezing upstream? Is that a concern? I have no idea about water.
No, construction can be done on water systems during the winter. It does happen. So that's, if their engineer raises a concern, we will certainly consider that. But that's not what we've heard so far.
Okay.
It's not expected.
Other? Yes.
This being a system that it's not a well. To the town. These matters to provide enough.
The town, yeah, so this is, yes, it's kind of like the ICE setup where the town is required to provide 20 PSI to the connection, right, for the mobile home park. And then it's the mobile home park's responsibility to make sure it's 20 PSI under our regulations throughout the park. So this is actually under the mobile home park regulations that they have to supply this water since it's not a well. It's kind of like Nate's Floral Estates, similar, where it's a service connection off of the city of Ithaca for Nate's, and this is a service connection off of Tompkins Field.
The town has been able to maintain the correct pressure for this system.
We initially asked for an engineering study where that would be determined. They opted to go ahead with the engineering report and booster pump. So we don't have confirmation of that. So I can't say for certain. We think that that's a requirement for Newfield.
So any other questions or comments? So are we okay with a friendly amendment? I can't remember now who first and seconded to change the date from December 16th to January 30th, 2023. Okay, so that's what we're voting on then. So we're voting on all in favor based on the amended date of January 30th, 2023. Okay, and there's no opposition or abstention, so that is unanimous. Okay, thank you. So extended to January 30th, 2023. And if you run into supply chain issues or any other concerns from your engineer, to make sure that you're speaking with the health department right away. Okay.
Thank you.
You're very welcome. Thank you for coming.
For the, consideration.
Yes.
My only answer is that still the frozen pipe.
Okay.
Yeah.
You can work with the health department staff on it. Okay.
Thank you.
Thank you. Okay, so now I'm on number 9. Right? Lost my track. Okay, number 9, which is Newfield Estates. All in favor as written. Okay, first from David, I'm sorry. Yeah, first from David, a second from Sue. Said that a little bit wrong. Approve it as written. And then Liz or others, any questions or comments on this one?
So
This is a no permit one, right?
yes, they were operating without a permit due to failure to pay their fees. They have since paid the fee and the late fee. They now have an operating permit. There are extenuating circumstances with this situation, and we would recommend reducing the penalty from $500 to $400.
Questions or comments from board members on that? To making that change and reduction in penalty when we vote? Okay, so let's go ahead and vote on as written with the amendment of changing the violation in number 1 from a penalty of $500 to $400 due to some extenuating circumstances and also completion of the other activities. So all in favor with those? Okay, there's no opposition or abstentions, unanimous. Okay, last one is the resolution related to grassroots. Okay, so all in favor as written?
Hey, you need a motion?
A motion to approve as written. First from Ed, a second from Sue. Let's go ahead and open for discussion.
So this is a rather involved resolution with addressing a conflict situation. I think the grassroots has come before you on multiple occasions before. I think the main things to focus on are that this year we are requiring them to hire a licensed professional to prepare plans, prepare both the maps and then plans for implementing that layout at the festival, which are due January 15th. That's numbers 5 and 6. That who is Michelle Palmer is representing the company to do that. They have also hired professional engineer Steve Maybe to work on their water systems. We have revoked their advertising waiver. So they are not allowed to advertise the 2023 festival or sell tickets until we have we're requiring under number 4 that they have their water system plans in place and a schedule approval by the fairground board. They have to approve any changes to the water system that are actually on the fairground property. And we want kind of a schedule and a signed contractor to get those to have construction done by May 1st, 2023. Then we'll let them give them the waiver to advertise and sell tickets to the festival. We need accurate site maps before we'll let them sell camping ticket sales. And we'll be meeting with grassroots this Friday to discuss some of these things. Other parts of this are that they'll cancel the festival if they fail to meet the requirements of the order, and that they have to get a complete and final application submitted 45 days in advance of the festival, and have everything completed, laid out 5 business days in advance of the festival. So I think I've covered the main things. We should have a secure air-conditioned office trailer this year for our office. Those are the main requirements. Oh, and we are not allowing Dan Walker to submit plans due to issues we've had in the past with his engineering plans until 2026. Sorry. Also, I forgot about the culture camp. Because of the problems with the layout, we don't intend to give them a culture campground permit for more than like staff and workers and performers to go on site. So I think now I've covered the main points of the resolution.
And that last one, is that going to be based on numbers, like only X number of people will be able to camp there?
And sign list.
Oh, good point. This side. Thank you, Frank. The fine is 22,000 due initially, and then 20,000 is due on February 28th. However, that an additional 20,000 that is waived if they get in the layout and the implementation plan by January 15th, or I gave that to, yeah, by January 15th. And then there's another penalty due of 20,000 due on June 15th. That is waived if they have everything submitted and approved by then. So hopefully incentive to have good plans submitted on time.
So other questions from board members on this?
Ever assigned penalties for deadlines like this before? Is that's new?
For grassroots, I think that structure is new for grassroots. We have done it in for other things.
Hopefully it'll work.
Questions? It's big, so I'm going to just give people a second to. All in favor is written. Opposed and abstentions no, so that's unanimous as well. Okay. Good job, everybody. We're through the resolutions. We're going to move on to discussion and action in administration. And I actually wanted to add one thing to this, which is that, and this is just, we can just start talking about it, but not take any action about it, is I want to talk about the board member positions next year for president and vice president. Okay, just so we get people starting to think about it before everybody leaves. Okay, so the community health assessment and improvement plan, is that you or Sam or? Sam. Okay. Hi, Sam.
Hello again. Okay, so Ted and I are here. We're going to share a couple slides to give you, an overview of the community health assessment and improvement plan, and then the final documents that have narrative for both the community health assessment and the improvement plan will come together over the next month and then be available on our website. So I'll go ahead and share. Can everyone see this? What's coming up?
We had it.
Okay. So the community health assessment and improvement plan, we do this in partnership with Cayuga Health System, and it is a requirement of the state. So the purpose is really to identify main health challenges in our county, determine gaps and disparities, prioritize strengths, resources, assets in the community, and then ultimately to advance health equity. So our process included reviewing data, both state and local data, and as well as federal, like US Census, and then getting partner agency and expert input through our steering committee, including community voices and community input, identifying priority needs, and then for the improvement plan, selecting the goals and interventions. So to review, the New York State Prevention Agenda that we use as a guiding resource for this process is currently for 2019 to 2024, and then the state will revise the prevention agenda. So those 5 big priority areas were the same for the last process that we did: prevent chronic disease, safe environment, healthy women, infants, and children, well-being, and preventing mental health and substance use disorders, and preventing communicable disease. So I'll pass it over to Ted to talk about some of the data that was collected and reviewed.
Okay, thanks, Sam. I just wanted, we wanted to share some of the information that we collected from the community health survey, which I discussed with you or presented, talked about last spring. Ultimately, it went out during the month of July. We had about 1,569. That sounds like more than about, but that's still an about number, 1,569 final responses that we use for tabulation. As you may remember, we did some promotion for it and talked about it with you guys. Okay. So data sources, well, this is for the community health assessment. I guess this is not directly related to the survey. For the data sources for the health assessment, Sam already went over those. This is an image of one of the state dashboards. The state actually provides a lot of data. I think they do a really good job of providing data and the whole prevention agenda in general. So we also used the information that we got from the community health survey, and I just wanted to show a few of the slides. Okay, Sam, slides that we created around the question, how do you rate your health in the following categories? When we did this in 2019, we had four categories: physical health, dental health, mental health, and overall health. This year, we just pared it down to two, and then we cross-referenced them with the demographic data. In this case, poor was one, and then we had fair, good, very good, and excellent was 5 points as we tabulated. So I just think it's interesting, the graph on the left is for health rating by race, and sure you can't really see that because the type is very small, but the health ranking ratings for the Black community that responded to the survey, that's the second pair in, is quite a bit lower than for the other breakouts of race that are there. So I just thought that was interesting to show. Physical health is 3.0, mental health 2.9, whereas for white class it was 3.5 and 3.5. The only one as low as that was two or more races for mental health for 32. So that's really quite a bit lower. Health rating by age is also interesting to see. Whereas the 25 to 34 is the second group in, 35 to 44 is the third group, and there's kind of a dip, as you can see, in that 25 to 34 and 35 to 44, and then it slowly climbs back up as individuals age. So that's also, we thought, was very interesting cross-tab for this personal rating, self-reporting of health, of how you view your health. So the next slide shows a couple of more. This is health rating. On the left is health rating by income, under $15,000, and then up to 150,000 and more. And you can see there a steady climb in how individuals rated their health, both physical and mental, as the income increased. It's pretty striking. It's pretty interesting how that is just a steady rise up. This is well, social determinants of health at work, when you consider income a major social determinant of health. And I think it's important to see these and recognize them in the health rating by highest level of education, which is the one on the right. The less than high school is the first grouping, and that is way far the lowest among all the other levels of education achievement. And I think, is there one more? Okay, last one, health rating by housing. This is own home or apartment is the first group. Rent home or apartment is the second group, which is down. And then other is the third group, and other includes sleeping in your car, sleeping in a shelter, sleeping at a friend's place, and nursing home or assisted living facility. So it's kind of a catch-all. But again, the health rating for those who own their home and apartment is considerably higher. And then finally, this is kind of a smorgasbord, but each one of these, I think, does give you really an idea of, again, social determinants of health. So the first one is whether or not have you experienced, you or someone in your family experienced substance use disorder. If those who had said yes, they had, is on the left, and then the one on the right, so it's 3.3, and then have not experienced substance use disorder is 3.6. The next set is, do you have a chronic condition? Yes, have a chronic condition on the left, and no, don't have a chronic condition. You can see again the difference in those. And then the last one is kind of turned around the other way. You have get regular preventive screenings, and that is, the positive is on the left in this case. The negative, no, don't get regular preventive screenings, is on the right. And you can see there again, there's a clear difference between those two parts of social determinants or personal health and preventive situations. So again, we don't have statistics to say that these are necessarily significant differences, but I think looking at them, whether or not they're actually statistically significant, I think they're pretty evident that there is something going on with that. And again, for overall health and social determinants of health, we think it's a pretty good illustration of those actions at work. So back to you, Sam.
Thanks, Ted. So, so the data that we've reviewed, a lot of quantitative data, but also with the health system, they've done a lot of work over the past few years with some qualitative research that they've been doing, holding focus groups around their diversity, equity, and inclusion work. So, you know, we want to be able to incorporate in this process, and it's a work in progress. So, you know, we'll continue to refine the process for the next round and onward. But, you know, part of pulling together all this data is good, but then we also want to use it and put it into context in our community and be able to tell a story with it. So just to summarize some of, you know, how we look at the data in context, Tompkins County is definitely one of the healthiest counties in New York State overall. We have greater access to healthcare and supportive services than many of our surrounding counties. However, it's clearly not working for everyone. There are significant barriers to services and to overall health and well-being, leading to serious disparities in the health outcomes that we see. So again, the narrative that we pull together, you know, does hope to address this more and speak to the story that we're trying to tell. But it's something that I think, you know, our department and partners in the community, you know, think about and discuss regularly, but as a whole community, we need to be thinking about it. So our community health improvement plan, the plan that we put together is in the form of a like spreadsheet, kind of matrix. but then there is a narrative that's associated with it as well. And these are the priority areas, focus areas, and goals that the steering committee has recommended. And then interventions will be attached to all of these for the plan to be monitored over the next 2 years. So the priority areas are the same as the last round: preventing chronic disease, promoting healthy women, infants, and children, and promoting well-being and preventing mental and substance use disorders. I'm not sure you can see, but I've bolded in bold font are the new goals that we're adding. The others are also from the same as from the previous round. So under preventive care and management, we're adding increased early detection of cardiovascular disease, diabetes, and obesity. And then under mental health and substance use disorders, we are incorporating preventing opioid and other substance misuse and deaths, prevent and address ACEs, adverse childhood experiences, and then prevent suicides. And so I think especially these mental health goals are certainly very relevant. And, you know, we've all been hearing about them and participating in various initiatives to address. So I think it captures well what our community is focusing on right now. And, you know, certainly we address many of the goals that are in the prevention agenda and all of the priority areas. But this plan requests that we do select certain priorities based on the data. And I just wanted to thank our steering committee. This shows some of the representation that we have on that committee. And again, in future rounds, we'll continue to expand on our efforts to have inclusive voices in this process. So that's all for our presentation. If anybody has questions, happy to answer them.
So how do you assess your outcomes? I mean, you have a plan, right? Are you looking at a regular basis, whether you're meeting? You setting objectives as part of that? Okay.
Yeah, so that community health improvement plan matrix includes setting objectives and a family of measures, or like how we're going to evaluate and measure each intervention and its effectiveness. So you know, many of the interventions, because we have so much going on in our community, and you know, a lot of community-based partners who are addressing many of these areas. Many of the interventions are currently happening. They're, you know, we're not creating lots of new things out of this plan, that we're often just citing what's happening in the community already. So, so for that, we can turn to whoever's leading that intervention and ask, you know, how they already are measuring and evaluating that program or service, whatever it is. And then the prevention agenda, though, does list out objectives for each of those goals that I just mentioned. So some of them are pretty big, like improve, you know, this outcome by 5% or something over the next 2 years. So yeah, so that'll all be listed in the plan.
And a lot of those objectives are the sort of size and breadth of them is also difficult to measure in real time. And so one of the other things that we really focus on is evaluate by process. So if we have a particular process that we're following in order to work towards the objective that we've set out, then we can evaluate as to how that process is moving along. Is it rather than waiting to see if we actually move the needle on something large, we can watch the progress and say, okay, well, we've trained this many people, or this many individuals have come to this service, or that sort of thing. So how many communications? So it's really, a lot of it is just watching the process and evaluating by that.
Your board members, questions or comments? Thank you. I know how much work you all have put into that, because I was at a few of the meetings, so I know that it's taken you all a really, really long time and lots of work. So thank you for that, all that work.
Thanks, Christina.
I have one reflection, if I might. Under one of the categories, the plan talks about adverse childhood experiences. And through our programs where we try to help with parenting, et cetera, we try to help out and prevent some of those adverse experiences in the home. Back before the pandemic, I was talking with mental health about social media, and whether or not in school districts, for example, the issues about social media were part of their mental health program. And we seem to be finding out that there is room for improvement in our school districts in addressing social media, how it's used, what children can expect from it, and what they need to be aware of and avoid from it. And when the pandemic came, we were sort of on track to put together some information to submit it to the school district to see if our perception was really accurate, and whether the school districts might do more in terms of social media issues. I think as a health department, through the things we put out in our media from the department, we in some ways, and especially now that we're one department with physical and mental health being all together, we can try to address this social media risk more aggressively to try to prevent adverse childhood experiences. It's something that isn't going away, and it requires a tremendous degree of awareness on the part of vulnerable children to, when they see something, report it, discuss it with people who can help them put it into context. The second point I would make is that we aren't making any progress in terms of looking at and making further progress on a facility for safe consumption of substances to prevent overdose deaths, and to provide yet another portal for harm reduction, for long-term relationships with people who do have substance use disorder, in hopes of helping them access services that we do provide through our community. We are looking forward to the imminent opening of the detox unit on Trip Hammer Road, which is a major, major step forward. But we have more to do. And I know that some of these things are more difficult than others, but that doesn't mean that they aren't worthy of attack. So I think in those two areas, those are things that come up in my mind and as directions that might be fruitful.
Thank you. Yeah, I mean, I hope the plan serves as a good roadmap for the integrated health department, because it's covering physical and mental health. So I think it's great to have sort of some guideposts as you think about your work. Okay, so thank you again, Sam and Ted, for that, and for the work of everybody that was on your PowerPoint slide there that put a lot of sweat equity, I think, into that plan. Okay, so we've covered all the items that are on the agenda, but I did want to just put into everyone's minds a thought about next year. So our bylaws require that at our first meeting that we make some decisions around president for the board. So just so we don't get behind on that, because sometimes we do, and think last minute, I wanted folks to start thinking about that and who we might want to put forward for that. And Frank, I guess I was hoping that folks could perhaps email you directly. And since we, Marley and Shonley and the vendor wasn't here today, would you be willing to put out an email? Should be on the January agenda. And then I also just wanted to really encourage, I mean, we have new board members here. It's good to sit in the leadership positions on this. So I wanted to really encourage us to think about other folks who maybe want to sit in one of these positions.
Responsibilities for those?
Yes, yes. So, I mean, I know I make it look fabulously easy. Like,
I know you do.
yeah, so the obvious thing for the president is the working with the staff. They do most of the work on the agenda, but I think making sure that you understand what's on the agenda, that you're reading it, that you know if things are missing, that you're pointing things out that are missing, and coming to the meetings prepared. Then I think the second obvious part is just the running of the meetings while we're here. And that is really the bulk of the work. Now, I will say that outside of that, there are at times issues that maybe come up or task forces that come up where Frank might reach out and say, hey, like we have this, would you be interested or willing to come to this meeting to participate as part of it as part of the Board of Health? Those are generally optional and it's if your schedule allows. So I will say that I personally try to make my schedule allow that because I appreciate the invite, but I also think there would be an understanding if folks couldn't make it. I mean, I think Sam and Ted the community health assessment plan is a really good one where when they had invited me to start working on that and the time commitment for me to be able to do that. I mean, the amount of work they were doing on that was just not something that I could do. So I went to a few meetings here and there, but then I had to step back and say, this is too much for me. I can't get this involved. So, I think for the president, like that to me is like the scope of it. The vice president, I mean,
really just filling in.
yeah.
Anytime those other things come up,
Yeah.
it hasn't really happened much. And to your point about when we ask for support, if the chair isn't able to do it, then, we would ask them to help us find somebody from the board that might be interested to do it too. So it isn't always on the president to sit in those roles if they can't or aren't particularly interested in the subject matter. Try to make
Does that help? Yeah. Do you have any other questions or do other folks have questions?
Is it the term limits?
We're still waiting on the legislature so the bylaws are updated and in a draft form and ready to go. The only thing we're waiting on is the legislature to finalize their policy related to boards and term limits. That seemed to be moving ahead very quickly and then came to a screeching halt. So I don't know exactly where that's at, but we didn't want to put forward bylaw changes only to then have to change them again. Because I know the minute we put them forward, then they'll start working on the policy again. So I will follow up with them to see where that policy stands. But as far as the updates, they're really ready to go. The only outstanding issue is term limits, and that's going to be dictated by the legislature ultimately.
Yes,
Do we know if you and David are willing to serve again?
Okay.
Or you cannot answer.
You're doing such a great job.
I'm not opposed to doing it. It's just that I really want to encourage that others could also think about the opportunity. But I'm not at the point where I have to say I absolutely can't do it. But I think we have new board members too. So, and we had a really lengthy discussion about term limits the last time around and thinking about the importance of having new people sit in different seats. So That's all I'm asking. I wasn't putting it out there to say I absolutely am not doing it. It's just that I wanted to encourage that if there were others that were interested, that I would like them to step forward.
I'm thinking of stepping back from any of the things that I'm on. I would not want to be the vice president, and need to talk about whether I can actually fulfill the role of being a board member.
We'll send out a note to everybody and then nominations can occur.
Any other questions on that? Well, thanks, everybody. Everybody have a great holiday season for whatever you celebrate, and time off, I hope that's coming to folks, and we'll see everybody in January. Okay, thank you.